what exactly is scar tissue? Why do we know so little about scar tissue or adhesions? Well, for the most part, mainstream medicine has all but abandoned the study of scar tissue because they don't yet have effective ways of diagnosing and treating scar tissue. Instead, it's just brushed off as just something we have to live with. And the pain that's often associated with it is just treated with pain medicine, acting as a band-aid that has to be reapplied when the effectiveness wears off. So what is scar tissue exactly? Well, when we have an injury or infection, cells called fibroblasts come in to protect the area and knit it back together. Fibroblasts are rich in collagen, and that makes for a more dense connective tissue. They are very disorganized in nature and do not form in nice and neat patterns like the rest of our tissues. So this combination of disorganization and density is what makes up the bumpy, crunchy, and immovable, like stiff feelings that we often associate with scars, okay? So what are adhesions exactly? Well, all of our muscles and organs are encased by a layer of fascia, which is like a thin sweater, if you will, that covers, it goes through and separates muscles and organs. Well, scar tissue likes to travel along our fascia. So you could have an injury in your right hip and suddenly you will start to feel pains in your left shoulder. Scar tissue glues the fascia tissues or organs together, and this is what causes adhesions. In blocked fallopian tubes, adhesions are sticking the inner walls of the fallopian tubes together so that there is not enough space for an egg to pass through to meet the sperm. Now, this seems like it would be a huge problem, and in the world of fertility clinics, it can be a very expensive problem. But from the wise words of my dear hubby, it's not a problem, it's just a situation. And the fallopian tube formula system is the solution to this situation.